with the World Health Organization virtually to discuss the intersection between security and healthcare. We looked at it from various vantage points: workforce development, technology, and innovation. And we looked at it from a board of directors perspective as well. So in this session, we're really looking for the insights of those who are leading and who are in roles or have been in roles that have involved the security of data and personal safety. So for this session, we are honored to have Denise Anderson, who is president of the Health ISAC. Paul Connolly, until recently, was Chief Security Officer with HCA Healthcare and is now doing some advisory work. Mike Towers, who is the Chief Digital Trust Officer with Takeda Pharmaceuticals International. And Chuck Suter, who, again, until recently, was the Chief Technology Officer with MD Anderson Cancer Clinics and is now doing on the Board of Advisors with Color Tokens. So what I thought we'd do, Denise, is we'd start with you in terms of providing our listeners and viewers with some of the perspectives of what you're seeing from a health ISAC perspective.
Sure, great. Thank you. Thank you for having me. I'm delighted to be here. So in healthcare, I think there's a couple of impactful incidents that have happened, namely starting in 2015 with the Anthem breach and then followed up with the Premier and Excelis Blue Cross breaches. That was started the whole concern around data privacy and, of course, the whole focus of HIPAA. But then in 2016, we had the Hollywood Presbyterian attacks, which was the first really public ransomware attack against a hospital. And Hollywood Presbyterian, unfortunately, announced publicly that they were paying the ransom. And that basically put a target on the back of healthcare and let threat actors know that they had open season, that hospitals needed to be able to access data, to access images, to be able to treat patients. And so they were going to pay up if they couldn't get access to that. That also led to nation state attacks very publicly, not necessarily targeted against healthcare, but had huge impacts to healthcare. And those were the WannaCry and the Petya Not Petya attacks. Of course, we had supply chain attacks on the IT supply chain in SolarWinds and Log4j. COVID-19 had a huge impact on healthcare because healthcare was so important. It basically brought the world to its knees with the pandemic. And then we saw another impactful incident, which was the Colonial Pipeline incident. And I could get on my soapbox about that, but what it basically did was it caused this whole movement of mandatory reporting. And finally, another impactful incident was the Russian-Ukraine war, and that also brought some threats to not but with this data disruption, like wiping or manipulating data. And it's basically come down to the fact that lives can be at stake. And the other thing that a lot of companies are now realizing is that it has huge financial impacts. Not only if you pay the ransom, having to pay the ransom, remediation costs, the downtime costs, which are huge. I just saw an article in the paper where one hospital is still, after 2 years, still trying to recover from their attack. The forensics involved in it, the insurance costs that skyrocket after the initial premium is paid, fines that could come out of there. And then now we're looking at a lot of lawsuits. So it has huge financial ramifications. And there's a variety of threats that we're looking at. Number one, insider threat, which could be malicious or non-malicious. I just, again, was in the news recently, a insider from Ubiquity just got 6 years in jail for not only stealing data from his employer, but then threatening ransomware with them and going to the press with negative press to make it even worse. We've got supply chain to be concerned about. We've got hacktivists, which we just saw the KillNet attack, DDoS attacks against healthcare in the US and Europe. Of course, the criminal threat with ransomware and Actually, a report from Sophos just said that in Q1 of 2023, ransomware attacks are up 76% over the year prior. Of course, extortion is a new tactic that they're using on top of the ransomware, and then business email compromise. And I mentioned the nation state attacks, where we've seen the threat actors get increasingly sophisticated about what they want. And of course, they're looking at going at it through the lowest hanging fruit, which is people, through phishing, social engineering, and then of course, people doing things like not patching or having weak passwords, credential theft. And then of course, the infrastructure allows for some of this. Many of them open pathways like RDP, the remote desktop protocol, file transfer protocols, creating somewhat flat infrastructure, so allowing for least privilege across the networks. And then of course, vulnerabilities that are constantly cropping up all the time, and the threat actors are taking advantage of it. So those are just some of the things that, you know, as far as the threat landscape is concerned, are what we're looking at. And I think that there are things that we can do, and some of them are very simple things, such as information sharing, which I have to wear that hat as an information sharing and analysis center, but it is so powerful. The collaboration, the information sharing really does work. The threat actors, of course, are doing it on their end, and so we should be actively and aggressively doing it on our end. Of course, educating and getting the buy-in from senior leadership is huge. And then having an enterprise risk management approach is absolutely key. I think that is where I'll end it for now. Just a little bit of my perspective on that.
And, you know, Denise, that's a great way to kind of set the stage for what the industry is seeing right now. Now, Paul, from your perspective, all of these things that Denise is talking about, things that have kind of transpired over the last couple of years, as somebody who was leading a security team, were these things that you saw, what was the impact for your role and for your team in these cases?
Yeah, Denise, that was a great summary of the way the threats have evolved, the risks have evolved. So as Catherine mentioned, I retired about 5 weeks ago after 20 years as the CSO at HCA Healthcare, which is a very large, primarily US-based healthcare provider. So for us, it's been just an incredible transformation in the focus to know that there are attacks that are not just about, you know, annoyance or stealing personal data, you know, worrying about HIPAA issues, to attacks that literally could shut down our hospitals and impact our ability to take care of our patients, which everything revolves around that. So it's really been an extraordinary evolution. And if you'll humor me for a moment, being just recently retired, I'm kind of in a reflective mood over my career, and it's been an unbelievable transformation. I started in this field way back in 1984. Out of college, I went to work at the National Security Agency, and that was really the very beginnings of this field. If you're old enough, you may remember the Rainbow series. NSA produced the original kind of guidelines on how to protect your communications and computer systems. And had an incredible opportunity to become the first information security officer at the White House. And when I started under President Reagan, there was no internet. We were worried about, you know, attacks on our communication systems coming from the Soviet Union. And by the time I left a couple presidents later under Bill Clinton, there was an internet. It was a whole different ballgame. And it's just continued that same kind of incredible change over time. When I first started at HCA about almost 21 years ago, it was really difficult to get people to acknowledge that this was even important. And I remember literally 2 weeks after I started at HCA, we were hit by SQL Slammer. And I remember thinking like, wow, this is really tough. What have I gotten myself into here? And now, of course, look back on SQL Slammer like, oh, those were the good old days when that's all we had to worry about. But as Denise was saying, just the constant evolution of the risks have made this something where it's obviously it's a board level issue. It's a top senior leadership issue. It's a primary area of focus because so much is at stake. And speaking from the provider perspective, again, at the end of the day, not being able to take care of our patients is just something that we could just never accept. So the good news is that along with that evolution that Denise was talking about in terms of the threats and the risks that we face, we've made a lot of progress. Looking internally, you can never say you're done. You never say never, but certainly our ability to understand what we have, know what our crown jewels are, and put defenses in place around them has gotten so much better. The partnership that we have across our organization. We've done a couple interesting things over the years. We moved out of IT. We made it a separate business unit to make the point that this is a business issue. It's just an IT issue. We also brought privacy and eventually physical security into our group as well, so that we had basically all of the areas that were about protecting our data and our people and our operations all in one place. And it's risen to not only a board level issue where it's a standing part of the agenda for every board meeting, but also to a seat at the senior table of our CEO. And that visibility has just been incredibly helpful. So internally, I feel like we've made a lot of progress. Externally, the third parties that we work with have also progressed a lot in terms of how they've been baking information security into their products and supporting us. 10 years ago, it was kind of like we would buy something and it was all on us to figure out how to secure it. If something went wrong down the road, it was all on us. And that seems to be changing. And some of the new guidelines, for example, just issued by the White House seem to even push that further, where there's true partnership. And then speaking of the word partnership, the last thing I'll mention that has been a huge step forward is working with people like Mike and Denise and sharing information so that we can really drive our defenses based on intelligence of what the threats are and intelligence on where there are vulnerabilities. And the Health ISAC has been a huge game changer for us, and the work that Denise and her team have done has just been so valuable. And it's helped connect us with people like Mike. I mean, as a provider, we've kind of always looked up to the pharma and the payers within healthcare as ahead of us, and the willingness of folks like Mike to share information with us and work with us, and the same thing, even expanding it to people and our peers in financial services industries and other places that we've been able to gain from. And also the connection, I think Val mentioned this at the beginning, the connection with law enforcement, national, federal intelligence agencies, and so forth. All of that has really helped us up our game as well. So I was here, cheering your comments, Val and Catherine, at the beginning. I think the direction that you're going here with this organization is exactly what needs to happen. I mean, we all need to basically team together and help one another on any information that we have that could be shared and help somebody else get better.
Those are great points, Paul. And you, one of the, I don't think you might be aware of this, but one of the single goals that we had, or Val had, when establishing CFF almost 8 years ago, was to bring security leaders together with the C-suite and boards. So to hear from your perspective that there's that seat at the table is highly encouraging, because we hear in some of leaders from other sectors, they're not quite there. So from a healthcare perspective, it's excellent to hear that. Now, Mike, Paul did a really good job of referencing some of the collaboration that you've provided and the leadership that you provided and your organization has. what are your thoughts in terms of what you're seeing right now, what you've seen in the past, and the direction we need to be going in?
Yeah, thanks. And thank you for the opportunity. This is obviously really, really important discussion. I mean, Denise and Paul have summarized a lot of the challenges very, very well. And some of those that we have been dealing with and those that we are dealing with. I'll add a little bit of a different perspective in terms of challenges that we're being faced that may not be as acute now, but are definitely bubbling up and will be acute moving forward. So first and foremost is Takeda, like many of the big pharma companies, is a global organization. We operate in 110 countries. So navigating the privacy and regulatory landscape across the different global entities is extraordinarily challenging when it comes to some of the data privacy expectations or the differences in terms of how data residency must be handled. So, and there's continual, I would say, tension points need to be negotiated in terms of what could be perceived or real levels of surveillance in terms of what you can monitor, how deeply you can monitor things, how much predictive analytics you can apply to certain scenarios. So all of those present an interesting challenge. And I would also say that one of the reasons why I've worked in healthcare and life sciences for so long, just hit my 27, 28 years or so, is motivated by what we do for society. So we're all patients. We all live and deal with healthcare in some way, shape, or form. And I think we would all agree, and we've seen, there's been tremendous clinical advancements, but there's not been very, very strong data and digital advancements. So anybody who has to travel and go into an urgent care facility, it's not like walking into an airport with a passport and a credit card. You can jump on a plane. It's a whole different level in terms of healthcare and the lack of data sharing that's occurred between networks. And so the digital and data advancements that we've all seen and felt in things like travel or banking, COVID brought this front and center and is accelerating some of these digital advancements where much more of the care experience will be virtual. There's a significant push for values-based and outcomes-based care so that patients are no longer just taking a medicine, they're taking a medicine, but also some sort of digital companion or data companion to capture how it's working. So it's a real stat and a stat that we use all the time to communicate how massive the data challenge is becoming. 93% of life sciences data in the world today was captured in the last 18 months. So the challenge is going to grow significantly in terms of, imagining a world where people are wearing devices or providing data to report how they're doing. And back to the point I made before about other parts of our personal lives, with all due respect to our colleagues in the hospitality and banking industry, this data we're dealing with is a whole different level of responsibility. It's deeply personal, it's deeply sociological, it's tremendously deep from a family perspective. There's just a level of acuteness in the challenges here that are frankly quite unique from an industry perspective. So we're going to be making tremendous improvements in all of these areas, but also carrying with it a lot of new responsibilities. And the last thing I would say in terms of responsibilities, you can't turn on the television news or read any media lately without seeing anything around AI and some of the challenges that AI. We all chuckle with our friends and family when we talk about this new pair of boots or the shirt we saw in the mall. And the next day, somehow it happens to be on our Google feed, happens to be in our Amazon feed. We wonder how the hell it happened. But if that starts happening in the healthcare perspective, what are the levels of responsibility? How can we apply some of these amazing AI capabilities to help people stay healthy or to help people get advanced treatment for some of their acute conditions? But again, the level of responsibility is at a whole different level. So we have to be really, really careful that the ethical boundaries are appropriate, the guardrails are appropriate. So taking the industry forward from a data and digital perspective is going to be something that many, many and all security leaders are going to be facing as well.
Those are excellent points, and I think between the comments from yourself and from Paul and Denise, we're setting probably a really interesting tone for the discussion when we kind of open the forum up. Now, Chuck, from your perspective, you're now kind of sitting in some ways on the other side of the desk in terms of, leveraging your security experience and your experiences as the chief technology officer with MD Anderson, and now you're, taking on an advisory role with innovation company. What are some of the things you've heard from your counterparts? What are some of the impressions and feelings you have about the market right now?
So the thing I'll talk about is, the things that you have to do to do something about these challenges. So, I would agree with, the themes that have been brought up already, and particularly, the whole ransomware theme has just been a huge issue for the provider side of the healthcare arena. One of the largest electronic health record vendors tracks the downtime for all their customers, and a couple of years back, and they'll publish the general categories of the types of downtime that there is. And a couple of years back, the category that went to number one, and not by a little bit, not by a few percentage points, it was more than 200% of the next closest downtime was a security breach, and in particular, it was ransomware that caused the most downtime. And when you're bringing up the theme of responsibility and what you have to do to protect people, it's been demonstrated that these electronic health records really do make care better, and they save lives. They have a lot of features in it that make it so that people get better care than they would have otherwise. And if it's not there, you're not going to get it. So, there's, I think, larger impacts than are really being shared, because, there's no real good way to count the outcomes that didn't happen when, one of these ransomware attacks hits a major provider. And, the impact time is really something that is a major thing, because, if it's weeks, months that people are getting substandard care, it's, something that is just not measurable, the real world impact to people that would have had a better health outcome if there hadn't been the attack. But the question is, what do you actually do about it? For a long time, we've known about ransomware. I mean, ransomware isn't exactly new. It's gotten a little more effective over time. But basically, your theme is it finds a weakness somewhere, and there's all kinds of individual weaknesses. Whether it's the individual user that doesn't follow company policy, or just is caught unaware and clicks on something they shouldn't have, or there's some weakness in your perimeter defense, whatever the weakness is, there's some individual, relatively small weakness that ultimately then gets exploited. The attackers start moving within the organization from that one weakness that they exploited. And the lateral movement is the thing that ultimately causes the big damage, because that often is what leads to the entire organization going down. So we know about things like zero trust, where you treat all of your devices, as if they could potentially be compromised at any point in time. There's nothing special about a device on the network. It's the same as if it was, on your exterior, and you just assume that it may be compromised, and you only allow the specific communications that need to happen for business. The problem with that concept is, a very easy thing to imagine, but it's very difficult to go about doing. And the question is, how do you go about doing things that are potentially really difficult to do? The number of devices in a large healthcare organization, tens to hundreds of thousands of network devices, and then going through and individually trying to figure out what communications is supposed to happen is a very daunting task. And even doing things like addressing the known weaknesses, getting things patched and whatnot. The number of exceptions that an organization has to approve for late patching or no patching to allow for specific situations just increases the number of weaknesses that an organization is going to have. And then the technical side of the organization, is not going to get more people, more money to implement protections. They're going to have to do it with the budget they have, the people they have, and the net effect. And the reason why we're having a problem is a lot of these places, they just aren't able to get it done with the budget and the people that they have, and they're behind, and the attackers successfully find holes and move laterally. So I think the direction going forward is to start thinking more about defining exactly what needs to be protected through automated methods. Use software and tools to define these, what is good to allow the communication, and then be able to centrally block everything else. You have to have support able to do this. You got to give the actual implementers of the security something to magnify their abilities, so that you can use regular employees to get a lot done. There's a lot of competition for the top-notch network engineers, and these days the security implementers are hard to find and expensive when you do find them. So you need software tools that will help you define what goes where, and what needs to be allowed and what needs to be blocked, and then central ways of doing that. The plans of just saying that, gee, we should do more to protect ourselves, and we'll just react to threats, specific threats after they start happening somewhere else. those are the things that, ultimately get places into trouble, because somebody is always going to be first, right? The place that gets exploited, that leads to the alerts going out to everyone else. Well, they didn't get the warning, they got the attack. And the idea behind zero trust solutions is to stay protected always. If you think about what you're really doing, it's like you're at home, and you're trying to protect against thieves coming in and robbing your house. And the problem is, someone's trying to come through the doors or the windows, but there's no police to call to make them go away. In cybersecurity, the criminals are free to just keep trying and trying and trying. You have to have effective locks that will allow them to beat against your doors and windows indefinitely, because while every now and then you hear about some law enforcement, taking down some criminal rings servers or something like that, nothing really ever happens to the cyber criminals who are out there attacking. They're just going to keep doing it. So you have to have a way of having your protection there no matter what happens, and be effective even if you haven't gotten a specific warning. And you've got to be able to support doing a solution like a zero trust with tools that allow you to do it with your current budget and your current staff.
I could jump in first. And actually one thing I wanted to mention too, another thread that I think is one that we're not talking about yet, but is a really real one, is quantum computing and the impact that that's going to have on encryption. I can pose right now that even if the attacker siphons off data right now and can't break the encryption, at some point they will be able to. So it's something that I think we're a little bit behind on the 8 ball, and it's not just health, but it's every sector out there. And we need to get in front of that very quickly. So players in the healthcare space, for example, we haven't really touched on the medical device, but medical device is a very unique beast within healthcare. And when I first came over to Health ISAC, I was almost astonished a little bit at the finger pointing that would go on between the healthcare delivery organizations and the medical device manufacturers. And I was, immediately said, same team, timeout, same team here. We need to all work together on the same page. We've done a number of things within Health ISAC to help alleviate that. And I think we've come a very long way in a short period of time with understanding both sides' perspectives and the challenges and issues that both sides have, because the end result, as Mike alluded to, is the patient. And we all are patients and we all know patients. They could be our family members, for example. So it's really important that we focus on that. The other thing that I think, the supply chain is huge. And the other side to the supply chain is the concentration risk. So, and I know, Mike, you could probably talk a little bit about this, but during COVID, some of the pharmaceutical manufacturers relied on a packaging company for getting their therapeutics and vaccines out. The packaging company got hit by a ransomware attack and took them out. And everyone relied on them to get their product out. So it wasn't even just that they got attacked, their supplier got attacked and impacted them greatly. I also think that, we're talking about other players here. Of course, there's the cascading impacts of other critical infrastructure sectors like electricity and water, for example. But, those are things that aren't necessarily taken into consideration all the time. And actually in London last year, they had heat waves where they had to shut down data centers because the equipment wasn't running or couldn't run in the heat. They don't have very good air conditioning over here in Europe. So those are factors, those are other components within the whole ecosystem that really can have some big impacts to healthcare.
Yeah, I think Denise summarized some of the additional things quite well. I think the only thing that I would add is again, just a strong commercial, frankly, for the mission of an organization like the Health ISAC. This job is too hard for any one individual entity to do on their own. And recognizing that is step one. Step two is having the recognition of the importance of sharing. It's getting a lot better than it used to be, but there's still too much stigma, if you will, in certain areas of breaches or issues. Whereas my attitude is I've been doing this long enough that if I hear or see an organization that's not shared anything, I'm almost skeptical that they're hiding something, because everybody has. So, and recognizing that and sharing it as quickly and as openly as possible is really, really important. And Paul mentioned it before. One of the biggest disconnects in our industry is that the parts of the industry that are closest to patients are, generally speaking, the least funded to protect them. So it's really, really important that we have that cohesive sharing, not because anybody's telling us we have to, but because we need to, or we want to, because it's very, very important to share openly. I can tell you stories about how many of these issues that I've seen or that were risks to us that I only knew about because a peer of mine or another company had the willingness to share it. And when you compare the investment it takes to join an organization like the Health ISAC with some of the technologies that we're all investing in, it's a night and day difference in terms of value proposition. So that's a really, really important element. And the other thing I would add is from a mindset perspective, this is becoming front and center in terms of, we've all talked about things like being a board topic, an executive leadership topic. There's critical business value in this protection and in ensuring this trust. Understanding the business value element of these protections is really, really important. There's far too many CISOs and far too many security leaders, frankly, that treat this as a technical problem. They justify their investments out of fear. And both of those elements are the collective leadership and societal perspective, that's going to wane. We're going to have to make value-based propositions just like those in marketing are doing, just like those in research are doing. So understanding the value of these investments is really, really important. And that is a gap I see from an industry perspective, is that we wanted this seat at the table. We've clamored for this seat at the table. I think we all recognize it should have had a seat at the leadership table. But let's make sure that we can act like leaders and understand the investments we're making, the value they provide our business. Because it's really, really important from an investment perspective to make sure that when that honeymoon does expire, and the collective boards and leaderships are frankly tired of hearing how scary this is, they're going to want us to put things in value terms. And that's a really, really important level of maturity we all need to get to as well.
So Paul, you these are excellent points from your perspective, as kind of Mike said, that need for that collaboration and the understanding around technology. We talked a little bit about the AI factor before we started this session. What's your perspective on this?
Yeah, and if you don't mind, let me just add one quick thing to what Mike was saying, which was a great point when he was talking about how you put the value that this adds to your organization. I can remember one time a CFO telling me that he approved what I asked for because he didn't want to be the guy who said no, and then we had a data breach. And I guess I had the benefit of that, but that's not a healthy thing for the organization. And just as Mike said, leadership is making decisions on where we're making investments and what we're doing in marketing and what mergers and acquisitions. And sometimes they say no because the business value isn't there. And we need to look at cybersecurity the exact same way. And we talked a lot about the evolution in this field. And I think one of those evolutions is, as Mike said a moment ago, is getting the seat at the table, but then upping the game as a CISO to earn your keep at that table, be able to talk in business terms, to be able to show what your program is doing that enables the strategies that the organization wants to accomplish. And one more quick point on that in terms of going back to Val's question, in terms of a gap to fill. I think one of the real big benefits that Denise and the HISAC have provided is they've sort of leveled the playing field, because it's a double-edged sword, but I've definitely had advantages of being part of a huge organization, an information security team of almost 300 people. And smaller systems, there's just no way they have the resources to do that. So part of the need for information sharing is helping level the playing field so you don't have the haves and the have-nots. So those were all great points that Denise and Mike made. I just wanted to add those. As far as your question about generative AI, I'm a glass half full guy, so I definitely think this is going to be fantastic for patient care. I think it can be a huge boost to what we're doing in the cybersecurity world, how we handle our data. But obviously, it's the cat and mouse game. It's going to be, every time we find a way to use it for good, there's going to be other people out there finding ways to use it for bad. And it's going to force us to up our game. Our little conversation before this started, we talked about whaling and impersonation of senior executives. I mean, that's just one more example where AI is going to make that so much harder to detect. We've got to find a way that we're going to respond and put the right defenses in place. But it just it seems like it's not something where we're going to get the toothpaste back into the tube. So it's a matter of, I think Mike used the term guardrails earlier, putting the right guardrails around it so that we can take advantage of the opportunities, but do it in a way that is thoughtful and protecting the crown jewels that we need to protect.
So Chuck, from your perspective, anything in terms of gaps that your counterparts haven't identified, or maybe from your perspective you're seeing?
So, I'll add, sort of the need for speed is paramount, and the some of the things mentioned. So if we take medical devices, for instance, there's a number of competing demands there. While everyone recognizes they're on the same team, the medical devices, they have a responsibility to the patient, but also to regulatory agencies, the government, to make sure that they're doing the right testing to ensure everything they put on the medical device is in fact safe and effective, and the device will work as appropriate. In the IT field, we already have a challenge with, patching just computers, and whenever they're involved in a business-oriented system, there's some testing that needs to be done to make sure that they continue to work after a patch. The medical device vendors, have that challenge on steroids, right? The consequences if the patch doesn't work as intended, or has unanticipated consequences somewhere else in the medical device when it's delivering radiation to a patient, or delivering drugs to a patient, or measuring something that is necessary to maintain the life of a patient. Those things need to be done correctly. So there's going to be a necessary period of time between when a medical device manufacturer can approve a patch, and the alert might come out that, this is an imminent threat with known exploits, and it's still potentially months before they can address it because of the valid testing that they have to do, which brings in, you still have to protect these devices. It's not okay to say, oh, well, we know that and it's valid and we'll grant them an exception. So it's a known risk and it's in our risk management plan. Yeah, that's ways that you get through an audit, but that's not necessarily a way to get you through an attack. And, there's a big difference between getting through an audit and getting through an attack. Getting through audits are great as long as you don't get attacked. Putting in the infrastructure so that you can provide protection even with delayed responses like that is what's really necessary going forward. And I think things like the AI that's coming in, it is helping medical care a lot, and a lot of the infrastructure that needs to be protected is AI oriented protection infrastructure that is involved both in the research and in the actual patient care. But as others have said, it's going to be used both to help information security, but more importantly, it's going to be used to attack as well. So it's just going to increase the need for proactive care and ability to have something already in place before the attacks start happening.
So Val, these, and Denise was with us when we were in Davos in January. One of the things that and these leaders have talked about this kind of the changing role of the CISO, and more often the security leaders are now at the forefront of these discussions taking place in the C-suite and at the board level. Maybe it would be helpful to share kind of some of why that was a driver for the board book project that was initiated shortly after Davos.
No, I think, thank you for that summary. Yeah, it's very intentional why my title is Digital Trust, because we foresee a future, even if it's not here already, where how well we do data in digital will be just as much of an indicator of trust and reputation as the efficacy of our treatments, because it's becoming such an important way in which, and gone are the days where you can decide, oh, tech's involved here, but it's not involved there. Everything that we do has a data, digital, and technology foundation. So it is becoming more and more fundamental to the availability and sustainability of the industry and to the care we're providing. So in that respect, it's an important element of how we engender and maintain that trust with all parts of our ecosystem: patients, physicians, third parties, payers, regulators. So the list is quite long, as Denise mentioned. So it's a really, really important step forward.
I, I think that a lot of the issues we face, there's obviously technology, but a lot of them are people problems and process problems and things that we could easily fix. And so I really would encourage us, especially when it comes to information sharing, wearing my information sharing hat, of course, to work together to collaborate on these issues and to share information with each other so that we can help each other out. Because if we don't, then the threat actors will take advantage of that and they will win. So I always like to end with my favorite phrase from Pink Floyd saying, "Together we stand, divided we fall." And I think that's what we need to really concentrate on.
Yeah, I'll just real quickly clap my hands for what Denise just said, and going back to a point that Chuck made earlier, speed is of the essence as well. I think there's a lot of good things happening, a lot of opportunities to improve, and a lot of it will come by working together and moving forward quickly.
Yeah, and I think I'll just reiterate that, you know, we've got to do all this with, you know, existing or, you know, appropriately sized budgets, both personnel, time, and money. And there's no way around that. So it's everything we talk about needs to be achievable.
Thank you.
Bye.